Good evening, everybody. If you are able to see my screen and hear my voice, please type yes in the chat box. Today, we are going to do pharmacology. Pharmacology is a very important subject as far as NEET PG is concerned and INACT is concerned. This pharmacology is a very scoring subject. It is the knowledge acquired here is useful in solving the MCQs of medicine and pediatrics and even PSM also. So, if you are thorough in pharmacology, you will be able to answer many questions of medicine easily and pediatrics also. So, let us begin with the first question. The drug in the delivery system given below is used for what you can see here. What you can see, four options are given. A. Topical use. B. Systemic use. C. Both topical and systemic use. D. None. Well, here you can see this is a transdermal patch, and this is used for systemic use of drug. So correct option will be, what do you think is the correct answer? The correct answer is B, systemic use. Clinical effect of vitamin D is reduced by clinical effect of vitamin D is reduced by simultaneous, if you ingest simultaneously 5 times. The main clinical effect of vitamin D is to enhance intestinal absorption of calcium. With an average intake of 1000 milligram of calcium, its net intestinal absorption is only 150 to 250 milligram per day. Calcium is mainly absorbed in the duodenum and jejunum, that is proximal intestine, by an active transport mechanism regulated by 125 dihydroxy calcitriol, that is calcitriol. Parathermone indirectly promotes the absorption of calcium by increasing the renal synthesis of 125 OH2D3. Dietary lactose, proteins, and acidic environment promote calcium absorption. On the other hand, phytates, phosphates, oxalates, tetracycline, and alkaline environment impair calcium absorption. So phytates, phosphates, oxalates, tetracycline, and alkaline environment impair the calcium absorption. So the correct option here is clinical effect of vitamin D is reduced by simultaneous ingestion of phytates. Anandamide. Anandamide. Anandamide is A. Opioid. B. CK1 antagonist. C. D2 blocker. D. Cannabinoid neurotransmitter. Now, this anandamide is a cannabinoid neurotransmitter. Anandamide is also known as N-arachidinoethanolamine or AEA. It is an endogenous cannabinoid neurotransmitter. The name is taken from Sanskrit word ananda, which means bliss or delight, and amide. It is synthesized from N-arachidono phosphatidyl ethanolamine by multiple pathways. It is degraded primarily by fatty acid amide hydrolase, FAH, that is fatty acid amino hydrolase enzyme, which converts anandamide into ethanolamine and arachidonic acid. So inhibitors of FAH, fatty acid amide hydrolase, leads to elevated anandamide levels. So the anandamide is a cannabinoid neurotransmitter. So correct answer here is D. Anandamide is a cannabinoid neurotransmitter. Which of the following drug is preferred in WHO stage 4 for the condition given in the picture? Now look carefully. What is depicted in the picture? Well, here you can see prominent pulmonary arteries in the X-ray. In the X-ray, you see prominent pulmonary artery, which helps in the diagnosis of PA, that is pulmonary artery hypertension. For stage 4 pulmonary artery hypertension, drug of choice is IV epoprostenol. So the correct option here is C, epoprostenol. Acidic drugs bind to acidic drugs bind to A. Globulin, B. Alpha 1 glycoprotein, C. Albumin, D. None. Now, acidic drugs usually bind to albumin. Albumin. So the correct option here is C. Albumin. The drug in the picture is used for what is the drug? It is levonorgestrel. Four options are given: A. Breast cancer, B. Routine contraception, C. Emergency contraception, D. Abortion. Now this levonorgestrel pill 72 is used in emergency contraception. Two tablets are given and they are used 12 hours apart. So it is used for emergency contraception. Sugamadex is used for A. Organophosphate poisoning, B. Reversal of neuromuscular blocker, C. Treatment of local anesthetic poisoning, D. Treatment of central anticholinergic syndrome. Now, Sugamadex is a novel reversing agent developed for terminating the action of non-depolarizing muscle relaxant, that is rocuronium and vecuronium. This Sugamadex is a modified Y-cyclodextrin with high affinity for rocuronium and vecuronium. It encapsulates one molecule of neuromuscular blocker, so it is used for the reversal of neuromuscular blockers. Now, mode of excretion of cyclophosphamide is mode of excretion of cyclophosphamide is A. Lung, B. Liver, C. Kidney. Now, this cyclophosphamide is primarily metabolized 80%, and metabolites are excreted in the urine. 10 to 20% is excreted unchanged in urine, and 4% excreted in bile. So, the correct option here is C. Kidney. B. Beta 2 agonist causes all A. Hyperkalemia, except. What is the type of receptor given in the picture? Is it a G protein coupled receptor? Is it an ion channel receptor? Is it enzyme linked receptor? Is it nuclear receptor? Nuclear receptor. So what do you think here? It is the correct option here is. Well, you can see a pentameric structure. It is a nicotinic receptor made up of 2 alpha, 1 beta, and 1 delta subunit. So this is a ion channel receptor. So the correct option here is ion channel receptor. Duration of action depends on, well, this is from the general pharmacology. Duration of action depends on A. Clearance, B. Rate of elimination, C. Bioavailability, D. On. So the correct option here is D. On. Which of the following drug can cause thyroid dysfunction? A. Amiodarone, B. Ampicillin, C. Ibutylide, D. Acyclovir. So amiodarone causes hypothyroidism. Now let us look other drugs causing hypothyroidism are lithium. Lithium causes hypothyroidism. Sulfonamide, phenobarbital, phenytoin, amiodarone, PAS, para-amino-salicylic acid, rifampicin, carbamazepine. So it is amiodarone which causes thyroid dysfunction. Which of the following anti-migraine drug might cause the side effect in this picture? Here you can see gangrene is there. Gangrene is there. So which drug causes this gangrene? Which drug causes gangrene? This ergotamine causes severe peripheral vasoconstriction. So there is reduced blood supply and it results in gangrene in end organs, end arteries like fingers. So the correct option here is D, ergotamine. Dopamine, dopamine causes all of the following true except dopamine acts on dopamine receptor that is D1 and D2 and adrenergic receptor A1 and A2 receptor with no action. At lowest effective dose, it stimulates D1 receptor in renal and mesenteric blood vessels, so it improves renal and mesenteric perfusion. So the correct answer here is A, causes increase in GI ischemia, which is not the case. The side effect of digitalis are all. Now, side effects of digitalis is very important question. A, ventricular tachycardia. B, vasodilatation. C, nausea and vomiting. D, ventricular bigamy. Now remember, digitalis causes vasoconstriction and not vasodilatation. So the correct option here is vasodilatation. So digitalis does not cause vasodilatation, it causes vasoconstriction. Antiandrogen used in heart failure is A, carvedilol, B, sampretilol, C, spironolactone, D, abiraterone. So the correct option here is spironolactone. Spironolactone and eplerenone are the aldosterone antagonist. These spironolactone is a potassium-sparing diuretic. The diuretic effect is quite feeble. These drugs reduce mortality in congestive heart failure. So spironolactone is used in congestive heart. Which of the following drug might cause the side effect given in picture? A, antacids. B, bismuth. C, cisapride. D, sucralfate. This blackish discoloration can be caused by bismuth. Bismuth causes blackish discoloration of stool as well as the tongue. So the correct option here is B, bismuth. Gemcitabine is mainly used for pancreatic cancer. Maximum liver toxicity is seen with which anti-TB drug? Maximum liver toxicity is seen for pyrazinamide or fastest acting antithyroid drug is methimazole. Methimazole is the fastest acting antithyroid. Fastest acting antithyroid drug is iodides of sodium and potassium. Natalizumab is used in treatment of, we all know natalizumab is used in treatment of multiple sclerosis. The treatment of multiple sclerosis is a very important topic in medicine. So correct option here is A, multiple sclerosis. Special feature of glargine insulin is A, it produces a smooth peakless effect. So correct option here is it produces smooth peakless effect. This glargine insulin is a long-acting biosynthetic insulin. It remains soluble at pH 4 of the formulation and precipitates at neutral pH. Onset of action is delayed. It produces a smooth, peakless effect. It is suitable for once daily administration. There is low incidence of nighttime hypoglycemia. It does not control mealtime hyperglycemia. So correct answer here is mechanism of action of trilostane is mechanism of action of trilostane is 11 beta hydroxylase inhibitor, B 1 alpha hydroxylase inhibitor, C 3 beta hydroxysteroid dehydrogenase inhibitor, and D 7 alpha hydrolase inhibitor. Trilostane is a medication which has been used in treatment of Cushing syndrome, Khan syndrome, post-menopausal breast cancer in humans. So the correct option here is C, 3-beta hydroxy steroid dehydrogenase inhibitor. Treatment of choice for cheese reaction is. Now cheese reaction is a very important topic. A, prazosin, B, pentazosin, C, phentolamine, and D, phenoxybenzoate. So the correct option here is C, phentolamine. Essential drugs. A, included in the National Pharmacopoeia. B, should always be present at PHC. Those who satisfy the primary healthcare needs of population. D, life-saving medications. The correct option here is those that satisfy primary healthcare needs of the population. Post-marketing surveillance included in which phase of the clinical trial? Post-marketing surveillance is phase 4. The correct option here is phase 4. Which of the following is the most active against slowly dividing tubercle bacilli? It is rifampicin. Rifampicin. Drug contraindicated in G6PD deficiency is. This G6PD deficiency is a very important topic. Drug which is contraindicated in G6PD deficiency is. Well, all of them are contraindicated in G6PD deficiency. So correct option here is D. Which of the following antitoxic cancer drugs are competitive inhibitor of tyrosine kinase? It is imatinib and sunitinib. Which of the following drug might have cause effect given in the picture? What you can see here. Here you can see there is lipohypertrophy. Hypertrophy. Lipohypertrophy at the site of injection is due to inhibition of lipolysis, and it can be seen with insulin. So correct option here is C, insulin. Correct option here is insulin. Insulin. Ranibizumab is a monoclonal antibody against. Ranibizumab is a monoclonal antibody against VEGF, vascular endothelial growth factor. So correct option here is C. So with this, we finish with the important questions of pharmacology. Please watch this video again and again. Please like, share, and subscribe. You can join my ultimate NEET PG Masterclass, which will be for 3 days in the month of August. You can click the link in the description box to join the WhatsApp group. If you have any doubts, you can WhatsApp me directly on the given number in the video. And I wish you all the best for the NEET PG exam for both the batches. Wishing you all the best.